Welcome to A Parent's Guide to Child Development. I'm your host, Anna Marie Von Furley from Fledgling's Flight. Each podcast, we strive to give parents the tools they need to help their child thrive through conversations with experts in child development and psychology, where you can learn about the most important information that you didn't know existed. Today, we're diving into something we rarely think about, how your child breathes. Joining us is Luba Patlakh Kaplun, a speech-language pathologist and founder of Kidology, Inc., a nationally recognized pediatric practice that helps children thrive through speech, occupational, and physical therapy. Luba spent more than 15 years helping families understand how small changes in breathing and oral muscle strength can lead to big breakthroughs in speech and development. In this conversation, we'll explore how breathing impacts behavior, communication, why mouth breathing matters, and what parents can do to support growth one breath at a time. Welcome, Luba. I'm so excited to have this conversation with you.
That was such a beautiful intro about myofunction therapy. I love that. Thanks so much for having me.
Yeah, I didn't use myofunction therapy in the introduction because I'm like, nobody knows what that
People
is.
are not going to know, but that's exactly right. Breathing matters, and it's just on so many fronts with kids. This is such a beautiful intro. Thank you again.
Oh, fantastic. So let's dig in. What exactly does breathing well mean for a child, and why is it so important?
So if you really break down the human need, what are the human needs? Oxygen and water. You can't live without the two. And when a child is born, they immediately clean them so that they can start getting used to the exterior air. Oxygen is needed so that you can breathe, so that you can speak, so that you can eat. And it's so important that people have the proper positioning when they're breathing, because if they don't, it can lead to a variety of different concerns. And if you don't correct it, you grow with it, and you don't want to be growing with the improper posture. You want to grow with the right breath work so that you have enough breath when you're talking, when you're eating, and when you're sleeping. And when you're an athlete or active outside, also very important.
Amazing. So how can parents tell if their child isn't breathing properly?
So this is such a good question. If you and I know, like, when children are very small, obviously they have smaller nasal passages, features, oral features are smaller, everything is small. So people notice that when babies, they can like snort and make little sounds or sound stuffed up. While this is common, you should keep an eye, because if your child's nose is clogged all the time, they're going to immediately turn into a mouth breather, because how else are they going to obtain oxygen? So that is the first thing. If you have a newborn, really starting to focus on that nasal health and nasal cleanliness is so important. Get yourself a nose Frida. I don't know. Those are really difficult because the parent has to work really hard. There's electric models now, but keeping your child's nose clean. If you're noticing that even when the nose is clean, they're still having an oral posture, it could mean something else. And this is where it's really important that when a newborn comes into the world, parents will look into their mouth to see if they have a tongue tie. And you're not, just like checklisting, oh, is this wrong with my kid? Is this wrong with my kid? But as you're a new mother learning to feed your child, if you're breastfeeding or bottle, and you start to notice some difficulty or differences in their abilities, or they're just not latching, this is that signal for you. Hey, I need to go get my child tested for tongue tie. And you can go to your pediatrician, who will recommend either a speech pathologist like myself or a dentist who works in pediatrics. And they will take a look at the frenum. The frenum is the skin that's underneath the tongue. So if we open our mouth and put our tongue up, so put your tongue all the way to your roof. And there's your frenum in there. You have a very nice frenum.
Thank
Marie,
you.
I like it.
You say that to all the girls.
So that's it's a funny joke when people say that, for sure. But so that's the skin. If your child's frenum or frenulum, it's a cross-reference term. Frenum and frenulum are the same. Dental practices say frenum. Speech pathologists go longer, frenulum. I've started to call it a frenum too. But if the child happens to be too tight, it will hinder their ability to eat properly, breathe properly, because they won't be able to actually put it in the position it needs to lie because they can't reach it. So there's things that people can start to look at, and it's, as you open Pandora's box, things pop up. But just paying attention to how your child is breathing, if they appear to constantly be stuffed up, or if they are clear and are still using their oral, the mouth is open like this, that's not right. They should be, if you're not eating or speaking, your lips are sealed. Also, if you pay attention to the child at night, and again, same idea, the mouth is open, that is not a healthy habit.
Interesting. So, how do you determine whether or not that mm, the issue with their nasal passages is allergies or cold or, a
So definitely when people come over and they become my patient, that's part of my intake checklist. And I immediately ask, have you gone to an allergist? Have you gone to an ENT? Because it could be a slew of things. Is it a sinus thing? Maybe. Is it adenoids, tonsils? We do look at all of these things. And another thing to look for is if a child that young is getting sick all the time, generally it'll lead to tonsils being inflamed and collecting, sinus gook. And that could require a tonsillectomy, similar to a frenectomy or an adenoidectomy. So if you get these things removed due to ENT or sinal issues, you would need to then go to a myofunction speech pathologist to heal. But your question is more so how to pay attention, like what would be wrong with the sinuses. You know, Generally speaking, and your child should at that point would be a speaker. So after 3, we'll say the signs are different than the newborn stages. And if the child is small and you're paying attention to just the stuffy nose. If you've cleared it and the mouth is still open, that's your sign. Okay, so it's not just the nose. If they're post 3 years old and now they're speaking more frequently, but you're hearing a very nasally vocal quality, they could have a deviated septum or they could have something that's blocking in their nose. But a deviated septum doesn't cause a mouth breather. So that's a deeper issue. So you're going to want to just pay close attention. You know your child the best, and if it just, believe me, you'll notice it. Once you hear this chat today, and suddenly you will never unsee it again in the supermarket with your child, with your family, because you'll be like, oh my God, these people are all walking around with their mouth open. And that's not the way we're supposed to walk around.
So, what are some common signs that mouth breathing that parents might overlook?
I think that people just attest to, oh, my child has allergies, or oh, my child is getting over a cold. And kids are always getting over a cold. I mean, that's the reality. I sound a little congested myself right now. We're changing seasons, and it happens. People might assume it's nothing. And, or my favorite is, oh, well, my whole family breathes with our mouth open. It's genetic.
Oh,
That's not, doesn't mean that it's proper. Like I know a guy who's 21 has a sleep apnea machine. Why does a 21-year-old have a machine that's giving him oxygen at night? That is not what's supposed to happen. We are healthy beings. Healthy beings breathe and obtain nitric oxygen through their nose so that we can inhale all the right oxygen and expand our lungs and get a lot of red blood cells going. We don't want to be walking constantly shortening our oxygen flow when you're a mouth breather. And people can test it. If they don't believe it, try to breathe with your nose, mouth shut, and try to breathe with your mouth open. And it's a difference.
yeah, it's true. I feel like because when you're pulling in through your nose, it's longer and you're getting a
It's
steadier feed.
expansive.
Yeah,
Yes.
and then through your mouth, it's like it's a big gulp, but it's short, right? So
And
you have to do it more often.
this is 100% true. If people are out of the habit of it, you can literally set an alarm to guide you 5, 6 times a day. Start your day with some deep inhalations. I'm telling you, it's going to change your life. It helps with a lot of things. And I'm sure we're going to get into that. But if a parent is noticing more on the advanced side, the child is out of breath, or if they had to go up and down the steps and they come down and they're really not doing well, that's not how it's supposed to look. And anyone gasping for air or unable to finish a sentence and kind of like in between, those are improper breathers that need to be addressed.
Awesome. So here we go. How does breathing impact things like speech, sleeping,
Yes.
eating, and even behavior?
Oxygen So imagine a situation where you're not feeling well. Like the day is just not going. You're now like getting a hot flash of some sort. You don't feel well. Then you dropped your bag and everything fell out. Like things happen to go into a domino effect. That's just how life works. You're started off a little bit in a challenging way and then it just continues on. For me, if I was in that moment, I stop and I ground myself with my breath work. Why? Because that breath work, those deep inhalations, filling my nostrils to so that the nose hairs clean the air and I fill myself with good positive energy and flow. Now my head is going to clear up. I'm not going to be as hot. My body's going to regulate itself. I'm breathing, I'm coming back. And a lot of people utilize this in meditation and manifestation. It's just the best way to circulate and flow, and everything fuels off of that. So your mindset, a child is going to school and they can't focus well, if they know to take a couple deep breaths through their nose, their cognition is going to just work in a better flow. The blood is going to flow better because now the oxygen is fueling it. It's like the trees getting air outside. It's exactly like that, but it's internal for us and it fuels everything else. You have better energy, you have a better ability to think, and you're filling your lungs so that your vocals are not drying out. Your voice is going to be stronger. It has a lot of benefits, believe me, and it's become kind of like a popular fad recently to wear mouth tape for this reason, but it comes with its own safety measures. But the right oxygen, the right breathing through your nose has so many benefits that just start simply with the inhalation of that oxygen and the blood flow that comes from it.
Yeah, and as far as like eating goes, I was just recently sick and my nose was completely stuffed up. And I noticed that, I was more prone to choking because especially anything that like bread or
So
anything that sort of like
dangerous.
explodes when you bite it because I'm inhaling while I'm chewing because I
Because
had
you
to
couldn't breathe. You
breathe
had
because
to,
I
yeah.
couldn't breathe.
Well, and
Yeah.
so that is a perfect segue into the behavior piece. And I'm going to tell you why. So, you as an adult felt frustrated. You were like, I'm out of breath. I have to eat. I'm hungry. Imagine being a child and a child with a disorder, or disability, or diagnosis. It's a lot of sensory dysregulation when you cannot breathe properly. And that is why children who are mouth breathers or have autism tend to be mouth breathers. They're in a dysregulated state generally, and then add on things that are irritating them: bright lights, poor food intake, a food that has the wrong sensory feeling, and then they can't breathe. You're going to go wild. You feel crazy because you're like, everything's wrong. Ah, like someone help me. And that's literally how they feel. And then taking them out of that situation and giving them some compression and allowing them to breathe and regulate is really the way to get them back to a good behavioral situation. But it has to be constant. Same thing with talking. A little child who is breathing improperly, they're not going to have a good vocal quality. They're going to be mumbling their words because it's just, it all ties together. And it starts from this one simple thing. It sounds so simple, but it's hard because people aren't accustomed to it.
Yeah, I mean, I haven't. This is so many topics that I haven't even thought about. About how breathing ties to everything until like you can't breathe and through your nose. But I guess I never really considered that it would be an issue with children, right? So outside of colds, allergies, or
Yes,
whatever.
yes. But every child suffers from those things, especially today.
Yeah, it's true. So how are breathing and oral muscle strength connected to speech development?
Yes. So uh it's interesting because obviously I'm a speech pathologist first. I got the myofunction certification later on. Um, and the myofunction works with dental and with speech. Why? Because dental works a lot with the jawline, the teeth, so does speech, but dentistry came first. Uh, it's the truth. And the way that if a person is not getting or positioning themselves properly. So in the night, we're resting our whole body. We're sleeping, we're at rest. Our body is rejuvenating. Say you hurt your knee that day and your body is now at rest. And in the morning, you're going to wake up and hopefully the pain will be gone. Similarly, with your jaw, if you're sleeping with your mouth open like this every night, you're not resting your jaw. Your jaw is working so, so hard because it's open. And if you can envision a jaw with two screws, and eventually, if you have like a mailbox or something and the door is always flapped open, it's going to lose its form. Those screws are going to fall out. So it's so important that people understand that the more you sleep with your mouth open, you will deform your face because the structure takes place. It's like wearing a waist trainer. You're going to end up having a longer jawline because the strength of the shut jaw, the full closure, which keeps it tight, is lost. And now you're slowly, and it's like, how does that even work? But imagine the Scream mask, the movie Scream.
Yeah.
You literally are just like drooping the cheeks because that posture, that lift is not there. And it's almost like, if you unfortunately have experienced people who pass away and you've noticed the tongue falls down, but a living person, the tongue is up and the neck is up, and so is the jawline. The minute you allow that opening, you're deteriorating the muscles, the structuring, and deforming everything inside too, because you're not breathing properly. So it's so important to keep your mouth closed, especially at night.
And so does it also affect the way teeth develop?
It does, because too much exterior air in the teeth can cause decay. And despite, it's just that also children tend to, it's not always the case with an open mouth posture, but they tend to do a tongue thrust, and they're constantly putting their tongue in their teeth, and that can cause decay too, because you shouldn't have so much oxygen on your teeth, you shouldn't have so much moisture on your teeth. I mean, it's a constant thing, and if people get into a habit like that, they're doing it all the time. Like, you're talking like, 99% of the time, because it's just what they do. That's just how they have a memory of it. And with that same thing, the minute you're deforming your jawline, your sounds sound different because now you don't have that lifted structuring. Everybody's mouth, despite having different size tongues or different size oral cavity, we have the same sound positioning. When you put your tongue in a certain place in your mouth, you're going to make the sound that you need to make, like R or L or M. Those sounds are what create words. And if you're having a deformality, or your structuring is not as tight as it needs to be, your sounds are not going to be proper.
No, that totally makes sense. So can you, even if you, because you were saying now you can't unsee it. So
Yes.
aside from like the you were saying like the elongated face, the mouth being opened all the time, but in there, like, let's say you just heard a recording of somebody speaking who's
Yes.
breathing through their mouth. Can you
Oh,
hear that?
oh, that's such a good question. I should do a test like that. That's that for myself. I think for me, yes, because I have a trained ear. Um, Generally, so okay, imagine you went to the dentist and you had to get some work done, so now you have a numbness to your
Yeah.
face. So you can generally hear that because it's deformed and you have like a swelling almost. So it's kind of like in the way, and you immediately hear how it sounds differently. And then, so with the myo dysfunction, the only way, I think that if there's a thrust all the time, I would hear it. And I think that for me personally, I understand the people who are not breathing with their nose, and children do this all the time. They take these deep breaths in between. My mom said I could go to the store, and then we went here, and like, so I would hear that right away. And expressively, it's distracting. So yes, in some occasions, I won't say always. I don't know. I'm going to do this as a test, and I'll report back to you. But I think I would be able to tell.
Awesome. Is there a link between breathing and a child's ability to focus, self-regulate, and stay calm?
Yes, absolutely. And I'll tell you, I encourage my own children. I have three children, almost 10, 8, and almost 4. My son's birthday is next week. Who, whenever they're in a dysregulated state and they're having difficulty like gathering their words, or somebody's crying over something, or I always take them back to breathing. That is my trick, my tactic with them. And it works with them, it works with my patients. It helps them to ground themselves and just come back. Because when you're in the state of overwhelm, we're going to call it overwhelm, whether you fell and can't breathe, you are upset over something, you didn't get the answer right on something, and you're just so upset about it, the day's going wrong. There's a slew of reasons that could happen. It's life. People go through things. If you can train yourself to understand that, okay, I'm going to take these 5 deep breaths and I'm going to feel well and I'm going to get back. I'm telling you, it works. Like, try this next time. It's just a deep inhalation through the nose, and it lifted to my chest, lifted 3 seconds, and release. Shoulders should come fully down. And 3 like that several times a day will change your life. The behaviors will be better because now you're lighter. Your shoulders are not in your ears. Your posture is like positive and I'm ready to take it on. It changes you. It's changing you. So we're talking about two things. Obviously, the breathing is one side, but it's the proper breathing. If I was breathing through my mouth all the time, I wouldn't get that relaxed state. I wouldn't have the same flow. I would have oxygen. I would have less oxygen. I would have a dry mouth. I would probably be more prone to getting sick because germs. So keep your mouth closed. It's good for your head. It's good for your body. It's good for your overall wellness.
So for you're talking about little babies have little teeny little nostrils, and so it can easily get clogged. So then they default to breathing through the mouth, so they can survive. But so older children. So what is the reason? Is it just that as a baby they just got used to breathing through their mouth and they just
Yeah,
continue it, or is
literally
there
that simple.
something
So
happening?
if they have some passage deformality, of course, that's why you have to go before you come for myo. I always ask, did you go to an ENT? Did you go to the dentist? Because I need to make sure that those things are covered. I don't want to assume, because I don't see like that, like what they could see. So I don't want to assume that the child is available to receive the service and like I'm going to be working with their mouth and forcing them to breathe through their nose, but they can't. If they can't, they can't. That's why we check all those things. If
Correct.
that frenum is too tight and they can't lift the tongue, the proper positioning of your tongue in a full lip seal, breathing through your nose, is up. Your tongue is in your upper tract
Mhm.
fully. And we teach kids that by offering suction. So like you would open your mouth and you would stick the tip of your tongue to the top of the roof. There's your beautiful suction. Good. You're such a good model. I'm going to bring you on a video. So good. So that's how we start to do it. Then we do tongue clicks. And everything that we're doing, we're blocking off the ability to breathe with the mouth. So you have to breathe with your nose. That's why if they would come and maybe they did have a bigger issue, I wouldn't want to risk that. So they must come to me with all their documents in order, their visits in order and approved so that we can go. But yeah, I mean, it's not always that there's a bigger issue. It is sometimes just the muscle memory, and that's what they're used to doing. Yes, it is that they're genetic and nobody stopped them. It's a training. If you want to get good at Pilates or basketball or ice skating, you train, right? If you want to get good at proper breath work and it's going to change you depending on what your life's goals are, you train. So yes, it could be a bigger issue, but generally it is just a pattern.
Huh. So how early can parents start working on healthy breathing habits with their children?
They can contact me and I will give them exercises. I would love to do that. They can also research different exercises online or visit a speech pathologist nearby who is certified in myofunction therapy. And it's really just fun stuff. They could even buy, at the dollar store, they sell those little like birthday party whistles
Yes.
that pop out. You can get that for your kiddos and they can do that in the car and then you throw it out and use a new one next time. But that ability to block off the mouth, get that thing out, the little whistle part is the trick that helps with the breath work. So they're using their nose. They're also obtaining a large amount of oxygen to push out that pipe. We use one with a ball in therapy. It's really fun. They like to chase the ball around, but the idea is that the ball lifts up just a bit and then they suction it back down. But kids do kid stuff. I do a lot of different exercises to help with that.
So would that be around 18 months is the earliest, just when they start to learn to blow?
So 18 months is young. Our
Okay.
prime age for really getting myo is after 3,
Okay.
but I work with kids younger than 3 all the time. It's just more playful and we're kind of like preparing their mouth, we're using straws, we're playing games, we're correcting some articulation as we're going. That's just the nature of it. But to really get your memory and to understand the proper maturity at 3 is like they're going to remember.
Yeah,
Anything
yeah.
before that is just they're silly and they're trying. But if you're in a severe situation and a child already had a frenectomy and you want to start to work with them, we bring them in, we do different tongue exercises and just a lot of oral manipulation where we show them and model and they have to repeat it and then we play.
Mhm. Do you also have to work on, like, ways of strengthening the oral muscles as
They're
well?
the muscles of the masseter. Um, yeah. So massaging is good. Because if a kid is sitting in front of me like this, I go, oh, close your mouth. I don't want to see your teeth. And they try to hide the teeth right away, you know? So constant reminders and like little, reminders with physical as well, because then the touch, it will be a memory point for them, and if they catch
Mhm.
themselves, you're building awareness to what's happened, because under 3 they're not aware, they're sitting there. There's children who have such poor recognition of what's happening. You have drool coming out and they really need muscle memory and strengthening. So we put a spoon in their mouth and they have to hold it for a certain amount of time. These are exercises to strengthen these muscles.
And are those the same things that parents can do as well, or are those just things that really
Absolutely.
should be done in therapy? Okay.
These are things we could introduce. Parents can come and then they can practice this at home. It's safe and we show them exactly how to do it. We love exchanging videos and things like that too. So, absolutely can and should do it at home.
Yeah, when you were talking about the spoon in the mouth, it totally brought back a memory of eating peanut butter on a spoon, and then so you lick it, and then like
Yes.
you're just sucking on the spoon in your mouth.
Yeah. That's literally it.
Thank you for that visceral memory that I wouldn't have come up with today. Are there
Absolutely.
certain play activities or toys that naturally encourage better breathing and mouth development?
There are a couple of straws and then the toys, like I said, just like that little, any kind of pipe or whistle that's child friendly would be appropriate. But no, I haven't invented it yet. I will though.
Fantastic, and I'll sell it in my toy store.
Yes.
When should parents seek help from a speech language pathologist or myofunctional therapist?
I think that as soon as so it can be as early as recognizing a feeding concern. If the child is small and at home and you're just struggling, mom, I know I've been there. I've called lactation before. I mean, we've all been there. It happens. So if you're struggling from minute 1 and you're kind of like, they're not latching, I'm having difficulty, you can already call and start the process. We'll take a look at the frenulum and we'll see if a laser cut needs to happen and then do the training with the child. It really can start as soon as possible. The minute you recognize something, I never suggest waiting. I know a lot of people are like, they're going to grow out of it, it's going to get better, it's a newborn. It's really easy to wave things off, but please don't miss the chance, and starting sooner is better. I'm all for early intervention.
Are there other red flags that parents should know about?
I think that
Like,
I went over for what, I'm sorry.
sorry, I was just going to follow, just like besides trouble latching,
Yes.
and noticing their mouth open, are there other things that they should be seeing?
Yeah, I mean, if you have a very fussy child, a lot of people attest it to gas, but
Mm,
that's not always the case. I think that if a child is struggling with breathing, and you have to understand, obviously, they're coming out of a womb that's been filled with fluid and they were breathing completely differently there
yeah.
and surviving and thriving. So when they're coming out into the real world, the breath work starts immediately. And sometimes children need help with that. So paying attention to those things is very important. And if you're noticing something, don't wait, because the child could feel dysregulated at such a small age and they can't communicate that to you. So looking for cues, it's not always gas. Do your research and just visit a speech therapist just as another precaution. Check that off because it could change things for your family and for your child from that early age. And then that already will ease the behaviors moving forward.
So, what kind of progress do you typically see when a child starts therapy? Like, what changes first?
Oh my gosh, so much. With the breathwork addition, a lot of families report immediately within that first month of a calmer well being. Children are not as aggressive, their behavior starts to change for the better. Their ability to listen is better because they're just like slowing down, they know how to breathe. Their ability to communicate and their articulation is better. They're starting to hide their tongue and not do the tongue thrust all the time. So it kind of comes as waves, but these are a lot of things that we see transitioning pretty quickly.
And how do you make these exercises fun and engaging for young kids?
I stick my tongue out.
Ah!
They love that. They literally love the cheek puffs. Everything is really fun because for some reason, especially for pediatrics, everything that's around your mouth and your lips and your tongue is just so fun. But we blow bubbles and we chew bubble gum if they can. So it's a blast.
Now I wish I had had it.
See how much fun it is just explaining it to you. You're like, yes, I love it.
Can breathing work complement other therapies like occupational or physical therapy?
Absolutely. If and we sometimes have kiddos who hold their breath. That's another thing. So it's something we didn't really touch on. It's not exactly a myo, it's more of like a neurological, but that does happen. And if we have a kiddo in OT or PT who is holding their breath or eh, not breathing properly, they struggle because sometimes they have to run, sometimes they have to go up steps or jump on the trampoline. How are you going to do that if you're gasping for air? It's not a good situation. So we do some co-treats at Kidology, and the therapists are informed that if they're seeing that, they have to report it so that we can speak to the parents about myofunction and proper breathing. And it's a big topic where we are.
Well, I mean, even I was just thinking about myself when I do like Pilates or yoga or even stretching, and I'm doing something that I'm focusing on because I'm holding a muscle and holding my balance, that I also am holding my breath. And I have
Yes.
to be, somebody has to say,
Don't
breathe.
forget to breathe.
Like, so is it just that when you focus really hard, you stop breathing? Like, why does that happen?
That's so interesting. I think that generally when we focus on something, like there are studies about this, when a child starts to talk, because usually they walk before they talk. If a child starts to talk, they may regress in their walking or because the focus has a shift. So with the breathing, I think it's similar. You're so focused on holding yourself in a position. I take Pilates too, so I know exactly what you're saying. And I'm reminded all the time too, despite my deep connection with breath work, I have to be told, oh, don't hold your breath, don't forget to breathe. It's just human nature. And I think if you just embed that in yourself and talk to yourself inside when you're doing it, not to forget, it's just a transitional thing. We're human.
Awesome. So, what role do parents play in supporting progress outside therapy sessions?
Parents must do the carryover. It's so important. We're not a mechanic shop. You don't drop your car off and then pick it up all fixed up. We are a team. We work together. We work to counsel the family. We work to tell the parent how they can do things in a better way to encourage their child at home, remind their child, listen, I understand. I'm a mom of three too. I have business. I'm busy. It's easier sometimes to let something slide, but carryover is important. And if you really want your child to succeed and you've come to a place and you're already like evaluated and willing to work on something, stick to it because and aligning your whole family. So if your parents live with you or if your husband disagrees and doesn't want to do it this way or you're not willing to, put yourself in these compromising positions, for my expressive kids, I always tell parents, don't give them the thing until they say what you need. And they're like, that's terrible. They're going to cry. And I'm like, right, but it will change because they're going to be motivated. Similarly with the breathing, if they come to speech and they do the breathing with me once or twice a week, but go home and do nothing, they're not going to do it. It's
Right.
not going to get embedded the same way if we worked all together.
No,
So it's very, very important. Please work with us as a team.
if you could give parents one message about helping their child thrive through better breathing, what would it be?
I think that every child, no matter the age, may go through anxiety or changes or growing pains. And if you teach them this technique, a simple technique of breathing the right way through their nose, it will allow them to thrive because they're going to feel well. And if they feel well, that's already 50% of the way to doing well. So, in order to thrive, you need to feel well to do well. And that's my advice. Please encourage them because it will make a difference.
Amazing. How can parents get a hold of you if they have any questions?
I am known as Kidology Queen on Instagram. I know it's a little funny, but it's my name, KIDOLOGYQUEEN. I always respond to DMs. Post a lot of interesting things on my Instagram, on my socials. I'm also on TikTok and Facebook. They can find me there. They can send me an email. If they visit the Kidology website, my email is listed there too. We're just kidologyinc.com. And yeah, I would love to be of help.
Oh, fantastic. What I love about this conversation is that it reminds us how something as simple as breathing can have such a profound impact on our children's growth. Breathing isn't just about air, it's about connection, regulation, and readiness to learn. When kids can breathe well, they can speak, sleep, and thrive more fully. Luba, thank you for helping us see that supporting our children's development doesn't always mean doing more, it often means noticing more. For any parent listening who feels unsure where to start, remember small changes can lead to big breakthroughs, and every breath is a step toward growth. Thank you so much.
Thank you. That was great.
Thanks for tuning into A Parent's Guide to Child Development, where we decode milestones, demystify meltdowns, and occasionally question whether goldfish crackers count as a food group. Spoiler, they do. Make sure to follow us on Spotify and subscribe to our YouTube channel so you never miss an expert tip, breakthrough strategy, or aha moment that can make a big difference in your child's development. It's cheaper than therapy and less messy than glitter slime. We'll be back soon with more expert advice, real talk, and zero judgment. Until then, keep calm and try not to step on any Legos.